D, alterations in arousal and reactivity associated with a traumatic event or events occurred, as evidenced by two or more of the following: irritable behavior and angry outburst. How many of y'all have seen this? Very frequent. Hypervigilance. Does everybody know what hypervigilance is? What's going on? Who's around me? I get kids all the time come into my office, and I have a nice play therapy area set up, and there's a room between the front door. But if they can hear anything, anywhere, whether it's the hallway or the next room, what was that? What's going on? Hypervigilance. I actually call this the knowing when to duck syndrome. Because as a child, if you're in an abusive environment and you can learn what the signs are that a blow up is going to occur, you get out of the way. You can duck, you can hide. I have lots of kids who hide in the closets. All right, let's see here. Exaggerated startle response. What's going on? It's out of proportion to what's happening. We see when we talk about attachment problems in just a moment, we'll talk about food issues. We see this very often with food issues in children with attachment problems. They're afraid they're not going to eat food. Or they even hear the slightest noise and they freeze. Problems with concentration, I'm sure we've all seen this. Focus as well. Sleep disturbance. Difficulty falling or staying asleep or restless sleep. How many of you have children who come in that their caregivers are telling you that, well, they won't go to sleep until 1 o'clock in the morning? You lay them down and they just fight you. They're up all the time. Of course, nightmares, night terrors fit into the sleep disturbance pattern too. Frequent wake-ups. All sleep disturbance. Okay, number E here, the duration of the disturbance is more than 1 month, or else it's possibly acute stress disorder. The disturbance causes clinically significant distress or impairment in relationships with parents, siblings, peers, or other caregivers, or with social behavior. We'll talk about this more when we talk about attachment problems. The disturbance is not attributable to the physiological effects of a substance, medication, or alcohol, or other medical condition. Specify with delayed expression. This is another big change. If the full diagnostic criteria are not met until at least 6 months after the event, although the onset and expression of some symptoms may be immediate, specify whether with or without dissociative symptoms. We'll kind of move on. They talk about depersonalization and derealization. They actually covered this earlier. They're just saying here, make a distinction in your descriptive diagnosis. Remember what I said about the DSM-5 when it's in full force? There are no longer going to be axes. Everything is going to be descriptive. Everything will be on one line. Yeah, the 5 axes are disappearing. Okay, so but depersonalization, persistent or recurrent experiences of feeling detached from and as if one or more, or excuse me, if one were on an outside observer of what's going on. Derealization, persistent or recurrent experiences of unreality of surroundings. I don't see this as much with the smaller children, although it does happen occasionally. I usually see this more with tantrums with the smaller kids. I've had several cases through the years where children actually have fear-based tantrums and they will experience 2 to 6 hour tantrums. And they're literally not with us. They're somewhere else. Okay, symptoms of trauma or post-traumatic stress disorder. Teen and adults, of course, sexual acting out, impaired social interactions, limited self-esteem, paranoia, dissociation, tonic immobility. How many people know what tonic immobility is? Tonic immobility is usually associated with sharks. If you flip a shark on its back, it will go limp. It will just lay there. It's a defense mechanism. I occasionally get children into the office who experience tonic immobility. I had a child a couple of years ago that he was just looking at some toys, and I asked him, well, what do you want to play with? Would not move. This happens because they are so concerned about they're going to get hurt. If they don't do nothing, maybe they won't get hurt. Intrusive thoughts, depression, elevated anxiety, nightmares, trauma reminders, or flashbacks. For the children, especially the children 6 and under, but all children, irritability, aggression, manipulation. How many of your clients are manipulative? Developmental delays and cognitive delays. Let's talk about the developmental delays. The two that I see most often in my practice are social and speech. However, if we have a child who has been very severely neglected, or there was drug usage in utero, then that child might also have some physical delays and they need occupational therapy. Cognitive delays we talked about just a moment ago. Very poor boundaries. We're going to talk about this more with attachment problems. Limited self-esteem, sexual acting out, reenactments like we talked about a moment ago. A lot of them have ADHD symptoms. Poor focus, poor concentration, aggressiveness, irritability. Of course, research indicates to us that trauma does not create ADHD, although it can exacerbate it. Behavioral disturbances, lack of trust in caregivers or adults, paranoia, dissociation, tonic immobility, intrusive thoughts, depression, etc. Of course, it's not necessarily an inclusive list, but I think it's fairly inclusive at this point. Relationship between trauma and PTSD. Not everyone who has been traumatized develops PTSD. Not everyone who has been traumatized develops attachment problems or disorders. They may have problems concerning this, but another disorder may actually be more appropriate for the diagnosis. Especially with the new guidelines within the new DSM, because as we can see, it's more specific and it's a much longer criterion method involved here. Not all sexual abuse victims develop post-traumatic stress disorder. Not all physical abuse victims develop post-traumatic stress disorder. I'll talk about basal cortisol levels in just a second. Not all trauma survivors develop PTSD. So like, for instance, if it's a person who's just witnessed a traumatic event, they may not develop post-traumatic stress disorder. Not all victims of violence develop PTSD, and that's partly because everyone handles stress and anxiety differently. Everyone has different coping mechanisms. A lot of this depends on your upbringing, your own genetic background, your own natural innate ability to handle stress. Not all clients with post-traumatic stress disorder present with the above symptoms. I have a child right now that, going upon history and even just some of the things that she shared with me, you would have expected that this child would be very much in the throes of a trauma disorder. She's really not. She's handling it very well. Okay, basal cortisol levels. Excuse me. There's some interesting research being done right now concerning basal cortisol levels. And the focus of the study has been centering around concentration camp for survivors from World War II. And for a long time, doctors and psychiatrists and therapists utilized the old Freudian model of, well, if your children have experienced PTSD, but there was no trauma involved, then it's probably been a social transmission issue because they heard all of your concentration camp stories, so now they have some kind of trauma going on in their lives. Well, this research indicates to us this is possibly not true. The researcher went in and checked basal cortisol levels for children born to concentration camp survivors, and one of the things they found out was that basal cortisol levels for those children were very high. Researchers believe that when basal cortisol levels are very high, you're prone to developing post-traumatic stress disorder. Basal cortisol is a feel-good messenger inside of your body. And it's like serotonin. If you get too much of it, it can harm you. Okay, let's talk about complex post-traumatic stress disorder. Complex post-traumatic stress disorder refers to conditions of prolonged trauma or trauma that occurs at developmentally vulnerable times, resulting in effects more significant than are believed possible with standard post-traumatic stress disorder. In its most updated definition, complex post-traumatic stress disorder manifests from conditions that are repetitive or prolonged, involve direct harm and or abandonment by caregivers or ostensibly responsible adults. One of the worst things that can happen to foster children is they're moved around a lot. However, unfortunately, that's the norm in the foster care system. CPS has contracted with a new system that they're calling foster care reform, and hopefully that will be online within the next 5 to 10 years. It is supposed to be addressing this issue. Okay, occur at developmentally vulnerable times in a victim's life, such as early childhood, have great potential to severely compromise a child's development. A lot of times, children I see who fall into this category. They have severe developmental problems. Like I said a moment ago, speech delays, social delays, cognitive delays. I had a child a couple of years ago who was 5 years old and did not even know their ABCs. A lot of this was neglect. In their family of origin, the parents just didn't work with them. They set them in front of a TV, gave them DSs. This was their education. A lot of them have not even been enrolled in kindergarten or pre-K. Symptoms of complex trauma. If you get, in particular, a child in, but people at any age, who view abuse as a norm, it's a possibility they're a victim of complex trauma. And viewing violence as the norm. Well, Dad hit Mom, no big deal. I hear this a lot. Actually, believe it or not, I hear it in the other direction too. Well, Mom used to beat Dad up all the time. They talk about it like it's normal. Like you were watching a TV show, a documentary, and this is the way it is actually expressed, as a norm. Viewing drug abuse as the norm. Oh, my mom smoked some marijuana, no big deal. Oh, she did it all the time. They can tell you about rolling the cigarettes. The saddest ones, though, are the children who can tell you how meth is made. Because they've been there. They've seen it. I know more about making meth than I ever wanted to know. From my kids. They come into the office. That does include prescription drug usage, illegal substances, alcohol, and tobacco usage. Interestingly, the drug that can actually harm a fetus the most and small children is tobacco. Survivors can become extremely guarded and superficial, especially children. Got to protect mom. Remember a moment ago I said many of them come into care and they'd say, well, it's my fault that we're here. And they're coached. Even with supervised visitations where CPS is watching them, the parents still manage to coach them. One of the ways they do this, by the way, is, oh, I'll see you next time. Don't tell anything. You're going to get mommy in trouble. How many of you have children come in, they're terrified of the police? Several years ago, I had this sibling group, and all the kids were telling me that the police were these terrible people. You didn't trust the police. So we started talking about it, and come to find out what it was, mom had warrants out for her arrest for drug possession and prostitution. And when the police would come and knock on the door, they would all go hide in the closet. And she would tell them, the police are terrible people. They're going to take your mommy away. They tell them very often, Child Protective Services, don't talk to those people. You're going to get mommy in trouble. And, of course, sexual acting out. On the sexual acting out, let me say this just real briefly. Of course, they may be reenacting what has happened to them. I have also had a lot of children over the years who have witnessed mom and dad having sex, and they're acting that out. I've also had a lot of children come in, well, you know, mom and dad had this movie, and while they were neglecting them, the kids go get the movie, pop it in. They act these things out. But now I want to talk about some basic principles of attachment and bonding. How many of you do work for Child Protective Services or with Child Protective Services? One of the things I hear very often, I even hear this from the court system very often, is, well, are the parents attached to the child? No, they're not, okay? Because in the world of attachment and bonding, children attach. Parents and caregivers bond. What's the significant difference? The significant difference is attachment for children refers to survival. Okay? Either they learn to trust that adult and that caregiver, or they don't. Bonding is whether or not the parent actually likes the child and will take care of it. When is attachment important? Now, you notice number A here, I have in utero and a big question mark. A lot of research going on right now concerning this. We do think it is possible, especially with children who are exposed to domestic violence while the mother is pregnant, the mothers who use drugs and alcohol, that there's a possibility they are developing attachment problems within the uterus while they're being developed. We do know, or at least we think we do, researchers do, that children sometimes learn books that are repetitively read to them while in utero. They can hear music. They remember music when they come out. Why would they not remember trauma? Also, remember what I said about the basal cortisol levels a couple of moments ago? Well, a mother who's under stress, where are her basal cortisol levels? They're through the roof. Guess who also gets it? The fetus.